These are the scenes that shook a city. COVID-19 patients forced to wait outside overcrowded hospitals for days as temperatures dropped. With the government requiring that everyone who tests positive, regardless of severity, be placed in isolation, patients and staff alike had no other option. In response to public outrage, authorities have issued a new decree demanding that these patients all be brought in from the cold. But with thousands of new cases every day and facilities already over capacity, healthcare workers say this is no solution.
咁只係將個問題由戶外搬咗去室內。咁而家面對嘅情況就係好多嘅確診病人其實擺喺一啲普通嘅病房咯，但係個普通病房咧本身係冇一啲即係所謂感染控制嘅設備嘅，例如可能係一啲負壓系統啦。
Hospital employees are caught in a catch-22 and must put political demands above what they consider best for their patients.
即係政府嘅即係一啲嘅宣傳啊，都係同大家講啊，呢種疾病係好危險嘅，越有高度傳染性。如果你真係確診咧，就係記住要隔離，要去醫院求醫。
After 2 years of fear-mongering and little preparation by the government, they say the current crisis should come as no surprise.
所有醫院之後本身就冇一個所謂即係應對嘅方案，即係醫管局咧就冇俾一個應對嘅方案俾一啲醫院去睇下點樣處理大量確診病人入院嘅時候要點樣處理就冇嘅。
After many healthcare workers volunteered as protest medics in 2019 and criticized the health impacts of widespread tear gas use, they were already in the government's crosshairs before the pandemic. When they organized a strike to demand immediate government action to stop the pandemic in early 2020, it triggered a political purge that caused mass resignations and weakened unions.
The health workers were trying to tell the government that if a major outbreak occurred, the doctors and nurses and other health workers simply doesn't have capacity to accommodate all the patients, and thus would pose a huge public health crisis. And what the government did was to demean the health workers and shame them for disrupting public health systems, threaten them with firing them, and also to take repercussions against some of the leaders of the unions. One of the union leaders of the health workers were later arrested for national security-related crimes, and doctors and nurses who participated in the strikes were also facing some disciplinary punishment, including their salary was deducted.
Local hospital workers and public health experts say that instead of listening to their concerns, the Hong Kong government is continuing to demand the impossible and is now looking to Beijing to make it happen. With cases on the rise daily, the government is now making plans for population-wide testing, a move that healthcare workers say will put them under even more pressure and could create more opportunities for the virus to spread. Ryan Ho Kilpatrick for TaiwanPlus.